Hello and welcome. Thanks everyone so much for joining us today. We're so glad that you're here. My name is Coral Owen. I'm the Professional Development Coordinator for the Military Families Learning Network, and it's my pleasure to welcome you to today's discussion on probiotics with Dr. Wendy Dahl. In case you're joining us for the first time, I'd like to give you a brief tour of our webinar platform so you can find your way around. Hopefully you're currently able to view the slides we're sharing. If you can't see them or have any other technical difficulties today, you can send us a tech support request via email to milfamln@gmail.com. I'll place that email address in the chat here in just a moment for your reference. As many of you have already done, we do look forward to having you join us in the chat pod today for conversation and for questions. To embed the chat so you don't miss any of those links or conversations, simply place your cursor over the shared slides. You should then see a toolbar pop up across the bottom of your screen, and then from there you can select the chat bubble icon. When typing your questions and comments today, please be sure to select that all panelists and attendees response option. You can find that in the drop-down menu right above where it says type message here. This just ensures everyone who is on today's webinar can view those comments as they come through in the chat pod. We'll also be covering evaluation and continuing education information at the end of today's session. I'd also like to note that you can download the slides that we'll be referencing today, as well as the additional resources, also via the event page. And we'll place that event page link in the chat here in just one moment. The Military Families Learning Network is part of a DoD-USDA partnership for military families, and our passion is to connect military family service providers and cooperative extension professionals to research and to each other through innovative online programming. It's my pleasure to turn things over to my colleague, Robin Allen. She is a registered dietitian, the program coordinator for the MFLN Nutrition and Wellness team. She'll be introducing our speaker today, as well as moderating today's session. Robin?
Thank you, Coral. Today, I'm very pleased to introduce Dr. Wendy Dahl, registered dietitian, associate professor of food science and human nutrition department at the University of Florida. Dr. Dahl leads research examining the effects of fiber, prebiotics, and probiotics on gastrointestinal and general health and disease. I will now turn it over to Dr. Dahl.
Thank you for the introduction, Robin. It is my pleasure to be here today to talk to you all about probiotics and health, some of the current evidence for health benefits, some of the tips for recommending probiotics to your clients, and also to introduce our gut microbiota and how foods that we eat support our gut microbiota and health. So what comes to mind when I say probiotic? Well, I study the effectiveness of probiotics and in my research, like many others do, and my research has focused on gut health, issues of constipation and diarrhea. But as we learn more and more about the connections between our gut and its microbial occupants and immunity, inflammation, brain function, pain, etc., I really expect that the field of probiotics is going to continue to grow. It probably is going to explode. Today, though, I'm going to highlight some of the common health conditions where there is significant evidence to support the use of probiotics. So let's first review the definition of probiotics. And I expect that many of you have seen the definition, but we're going to emphasize the parts that I've underlined because we're going to apply this definition in a few minutes. So probiotics are defined as live microorganisms when administered in adequate amounts, confer a health benefit on the host. And so that's the World Health Organization definition. The host could be a human, it could be a dog, cat, horse, it could even be farmed fish. Although there's been some studies to show that substances that are produced by probiotics and even dead microbes might have some health effects, when we're talking about probiotics, by definition, they must be alive. So here in the US, probiotics are considered dietary supplements, not food or drugs. and are not specifically regulated by the FDA. However, FDA approval is needed for testing probiotics as drugs to prevent or treat disease. So, for example, let's consider the microbe Lactobacillus johnsoni, N62 to be specific. You won't be able to find any products containing this exact microbe online or at your local pharmacy. This probiotic has an IND, which means it's registered as an investigational new drug. So studies have shown that this particular strain of microbe can prevent type 1 diabetes in animal models. So at the University of Florida, we tested its safety in healthy people. That's known as a phase 1 trial. And now we are testing it for safety in adults and children with type 1 diabetes. So if we find that it's safe, it will then be tested to see if it actually prevents type 1 diabetes in children. So my question to you, is it a probiotic? It sure sounds like one, but we're not sure if it is a probiotic for humans yet. So far, it's only a probiotic for the lab rat. So probiotics are marketed in many forms: capsules, tablets, sachets, sticks, and drops. And drops are especially great for infants. And probiotics are added to many foods, such as chocolate and yogurt balls and breakfast cereal and beverages. But many foods are acidic, or they contain flavoring compounds like mint or menthol. And those substances can actually kill the bacteria. So probiotics aren't added to foods that are acidic or contain those compounds. Heating foods will also kill the added probiotics. So foods that require reheating are not good candidates for added probiotics. Not all foods actually work well for added probiotics. As I mentioned, we need to keep the microbes alive to consider them as probiotics. So definitely some products are sold without testing to confirm that they have health benefits. And because they're dietary supplements, they're allowed to be marketed. But only microbial species that have shown health benefits in well-designed human studies should be considered probiotics for humans. One of the difficulties that we encounter as researchers is to keep a probiotic from becoming a drug. I just gave you an example of a probiotic that we're testing as a drug, but most of the probiotics that we test and are out in the market, we want to keep them as dietary supplements, not have them as drugs. So we can't test to prevent or treat a disease or it becomes a drug. So diarrhea is a disease. Fatigue can be a disease if it's chronic fatigue syndrome. So how do we study a probiotic's effect on these outcomes if we cannot target people with diarrhea and fatigue? So this makes it really difficult to test the effectiveness of probiotics in the US. Somehow we have to actually show a health benefit in healthy individuals. It's like, for instance, showing that the probiotic lessens the symptoms of a cold versus preventing colds and flu. And similarly, it would be preventing the symptoms of fatigue versus studying chronic fatigue syndrome, if that makes sense. So a bit more about what is and what is not a probiotic. You read almost everywhere that the term probiotic is used synonymously with live and active cultures. So many people assume that all yogurts then contain probiotics, which is not the case. Live cultures are used in the fermentation of foods, are not probiotics if no studies have been done to actually show health benefits of these microbes. The health benefit to be considered a probiotic needs to be just the microbe alone, not the whole yogurt. So a yogurt would need to be compared with and without the live microbe to see if there's a health benefit. So the fermentation strains like the Lactobacillus bulgaricus and the Streptococcus thermophilus are not generally considered probiotics. So you can see on the red label, there is also, in addition to those fermentation species, there's also the Bifidobacterium lactis. And that might be a probiotic, but we don't know how much has been added. There's nowhere on the container that says the dose that's in the product. So it could be a few hundreds of thousands of cells, not enough to have a health benefit. The lower label definitely contains a probiotic. It gives the strain number, and elsewhere on the product, actually, it gives the amount of the probiotic. And actually also ensures that that number will last until the end of the shelf life. So not all yogurts contain probiotics. So what about other fermented foods? These foods are also often called probiotic, but do they actually contain enough live microorganisms? So are there microorganisms there in adequate amounts? Have the microbes used for the fermentation be tested for a specific health benefit independent of the health effects of the food constituents? So what I mean is that perhaps the sauerkraut has been tested for a health benefit, but is it actually the fermentation microbe that has the health benefit, or is it the products of the fermentation process, such as some bioactive compounds that have been produced in the food? So many of these microbes, again, that have been used for fermentation have not been specifically tested for health benefits. So what makes a good probiotic? Well, they definitely need to be alive when they reach the gut. So we're usually meaning the small intestine, but a probiotic could have a health benefit in the mouth. For instance, there are probiotic gels formulated for oral use. So in this case, the microbes don't really need to survive the rest of the gut if they're swallowed. In most cases, we expect the probiotic to be able to transit the small intestine. They need to survive the acid of the stomach, the bile acids, and they need to be able to resist other bacteria. They must be safe. Probiotics should be accurately identified, so it should be down to the strain level. So if a product does not say what the strain is of the probiotic that's been added, I would wonder about that, because they should know what the strain is. The probiotic should be free from contamination of other microbes, and it should be labeled properly. And also, probiotics should have been tested to make sure that they don't cause any stomach upset, diarrhea, or other side effects. And of course, they need to be tested to see if they have positive effects on human health. So what reasons do your clients take probiotics?
So for our participants, go ahead and type your answers into the chat pod. So Wendy, I don't know if you can see, but we're getting a lot of IBS, C. diff, constipation, following antibiotics.
Right, that's great.
Yeah, GI motility, diarrhea.
Yes, I see that, and we're going to be talking a little bit about that. But yes, there's high level of scientific evidence to support the use of probiotics in all of those GI conditions. So that's great to see. That's great. All right. So now let's take a look at the general health benefits of probiotics. Various species of bifidobacterium, animalis, bifidum, the image there, the top image is bifidum, longum, and lactobacillus, acidophilus, johnsoni, and rhamnosus provide general health benefits. And so you can be pretty confident if you're taking any of those species that you may be getting some general health benefits. The dose is measured in colony forming units or CFUs, and those are live cells. And a minimum dose of 1 billion CFUs is really likely needed to provide general health benefits. But what about combination formulas? Is it okay if there's like 3 or 5 different strains that add up to a total of 1 billion? That's one of the things that at least I wonder about, because I really don't think it quite works that way to be able to add up the strains, because each of the strain may have a differing health effect. They might not have additive health effects. And so if you're taking a combination strain and you want to see 2 different health effects, you probably want to pick a supplement that provides at least 1 billion of each of those strains. So most probiotics inhibit pathogens, disease-causing organisms, and they do this by competing for binding sites in the GI tract, and they also produce beneficial fermentation products such as short-chain fatty acids, and those are essential to gut health and overall health. But those compounds are also produced by the current residents, the current microbes that are in our gut microbiota. So probiotics aren't unique in producing short-chain fatty acids. So many probiotic species also produce vitamins and useful enzymes, but again, so do many of the microbes that are in our gut already. But perhaps most importantly for probiotics communicate with the cells of our gut to maintain gut health, such as for maintaining barrier function. You probably heard about like leaky gut and that type of thing. So probiotics can actually modulate the mucus production in our GI tract, which is a physical barrier. They can also function to keep the tight junctions between the cells that line the GI tract nice and tight. And what probiotics also can do is they can modulate the sensitivity of our GI tract. So like, for instance, people that have IBS are really sensitive to gas and bloating. And so what's thought is that the probiotics can actually decrease that sensitivity. So they still have as much gas and bloating, they just don't feel it as much. So a few probiotic strains have immune, neurological, and other body system effects. And as I mentioned earlier, certain probiotics are considered drugs if they've been shown to prevent or treat disease. So bacteria and yeast, because some probiotics are yeast, they differ in their health effects. And so each potential probiotic needs to be tested. And animal research, I actually can't say this enough. I often include this in my presentations, that animal research cannot be used to support direct recommendations for humans, but animal research studies are important for hypothesis testing and figuring out mechanisms like how the probiotics might work. Human research studies are really needed to test all potential probiotics. So these days, the results of a single study should not be considered enough to prove a probiotic has a health effect. We need the highest level of evidence. We need a systematic review and meta-analyses. So, however, like, there's problems with these types of reviews when it comes to probiotics. Most of them, what they do is they pool the different probiotics together. Like, for example, they might be looking at studies that let's say if they're looking at studies on constipation, and they're looking at the results of studies that have tested bifidobacterium species and also lactobacillus species. And they find that, for instance, that there's no overall significant effect. But if you look more closely, it might be the studies that the lactobacillus were more effective. And actually with constipation, it might be the other way around. But we know that they might have specific effects. So it's been recently recommended that these high-level research, these systematic reviews and meta-analyses where they pool the results of studies, should really only be pooling the studies of a specific strain of probiotic. Because if they don't do that, it's like comparing apples to oranges. So if they're comparing bifidobacterium to lactobacillus, it's like comparing apples to oranges. It's like comparing different drugs with different mechanisms. But instead, they should summarize their research on a single strain. So if this is how we actually move forward in research on probiotics, we're going to need a lot more research, but the results will be much more accurate. So do probiotics work for constipation? Yes. If constipation is due to slow transit time, which is often defined as greater than 70 hours from oral to anal transit, typical transit time, most of it's in the colon, is usually about 24 to 48 hours. Certain probiotics actually initiate motor activity in the colon, and then they just simply move things through faster. So multi-strain probiotics may be more effective than single strains. Bifidobacterium lactis strains, we actually had a lot of hope. They seem to be showing a lot of promise for constipation, but now there's definitely conflicting evidence on whether or not they're effective. And so one of those studies actually we carried out the effect of bifidobacterium lactis, we call B. lactis, on stool form and stool frequency in adults with Prader-Willi syndrome. So if you're familiar with Prader-Willi syndrome, it's a well-known genetic cause of morbid obesity, but these individuals also report constipation problems. So we've used the Bristol Stool Form Scale as a proxy for transit time. And I expect some of you may have seen this tool. It uses pictures of stools and it rates the stools from that hard pebble-like stools that are considered slow transit to 7, which is fast transit stools or diarrhea. So unfortunately, we didn't see a decrease in constipation in this population that we looked at. We looked at the percent hard stools, and it does look like they went down a bit. They were at baseline, 31% of the stools were hard stools in this population, but was not significant. So we didn't, it was not what we expected. You can see though at the bottom line of the table, the Bristol stool form type 6 or 7, which are the loose stools, kind of diarrhea, increased from 14% of the reported stools at baseline to 17% during the probiotic period. And then surprisingly to 25% during the period after they stopped taking the probiotic. So the probiotic, like how do we explain these results? The probiotic might take some time to work, and maybe that's why we saw that. But we now know actually from more recent studies that we've done that probiotics might persist for quite some time after one stops taking them. And so they were actually having effect in what we call the washout period after there shouldn't have been a probiotic effect. But what we've learned is that patient populations may not respond the same as the general population. So I know many of you are dietitians, and that's something that you should keep in mind, that results that have been done on the general population, even though you can try these probiotics in your patient population, they might not have the same effect. So one of the other things about this study is that, again, because we don't want to be treating disease, what we did is it's a rare disease too, that we just recruited everybody that we could contact that actually had Prader-Willi. We might have had different results if we had specifically focused on only those individuals with severe constipation, for example. Then we might have seen an effect. So there's some good evidence for probiotics in preventing diarrhea. So there's a reduced risk of antibiotic-associated diarrhea, and I had seen that come up in the chat. So in hospitalized patients, but not so much in adults over the age of 65 years. Probiotics are safe and effective in preventing C. difficile diarrhea. That's the most common antibiotic-associated diarrhea, and Lactobacillus and Saccharomyces species and combinations of probiotics show reduced risk. So Lactobacillus casei being the most effective. So there's some other examples of probiotics that are effective in preventing antibiotic-associated diarrhea. Lactobacillus rhamnosus GG decreases the risk of antibiotic-associated diarrhea in children, and Saccharomyces boulardii is effective in adults. So what's really good to hear is that there's also some relatively new evidence to show that probiotics decrease radiotherapy and chemotherapy-induced diarrhea in cancer patients. And so that's really good news. And I'm hoping that there's more studies done to support that. So high doses of single-strain probiotics are effective in improving GI symptoms and quality of life in irritable bowel syndrome, IBS. And here's a list of some of the effective species and strains. So there's a high level of evidence to support the use of probiotics in the management of IBS. You hear so much about diets being recommended for IBS. And in the back of my mind, and as a dietitian, I'm always thinking, but we have really high evidence to support the use of probiotics in IBS. And so I would argue that that should be our first recommendation for IBS before we move to restrictive diets that may compromise the nutritional status of the patients. What these microbes seem to do is decrease what is known as like the visceral sensitivity that I mentioned before. So these individuals have been shown to not have any more gas production or bloating than people without IBS, but they feel it more. And so the probiotics are very helpful in decreasing that. And I also wonder whether probiotics also help to prevent fermentation, gas, and bloating at the end of the small intestine, where it actually is felt so much more acutely. So stomach ulcers are often due to H. pylori infection. So probiotics have been tested in conjunction with the antibiotic treatment for H. pylori. It's usually a 3 antibiotic treatment, and it's also in combination with a proton pump inhibitor. But it ends up that people that are put on this therapy often quit because of the side effects like nausea, vomiting, perhaps diarrhea. And so that decreased the efficacy of the treatment for H. pylori. And so strains of both Saccharomyces boulardii, which is the yeast, and Lactobacillus rhamnosus, GG, showed improvements in antibiotic-associated diarrhea directly connected to this ulcer treatment. So there's mounting evidence that probiotics may be helpful for weight loss. A greater effect is seen in overweight individuals. That makes sense, right? And that's what we would want to see. So individuals that have a BMI greater than 25, you see a higher effect. And remember that we can't treat disease. So some of these probiotic weight loss studies may need to include normal weight individuals. So they need to kind of have a sample of the usual population and then see if it actually works for weight loss. When really we'd probably see much better effects if we just used overweight and obese individuals. Studies of 8 weeks or longer of probiotic treatment have shown a significant reduction in BMI, but short-term probiotic supplementation reduces body weight, BMI, and fat percentage. But one of the things we need to remember is not by much. There was one study, it's not published yet, it was just completed, and it's pending publication, but it showed actually, they did a weight reduction study, and so both groups of individuals were on where their goal was weight reduction, and then they gave a placebo and a probiotic. And so the weight loss was the same between, when we compared the groups, the weight loss was the same. However, the people that took the probiotics felt better. They felt less hungry, and they just overall quality of life was better. And so I think that that's really interesting and something that we need to look at, that perhaps probiotics aren't necessarily the mechanism of weight loss, but they might make it easier. So it seems that both single and multi-strain probiotics may be effective in reducing fasting glucose, A1C, and insulin levels in people with type 2 diabetes. And so here are some of the species that have been shown to be effective. So again, there's Bifidobacterium longum, Lactobacillus acidophilus, and even some combination probiotics. So certain probiotics decrease total and LDL cholesterol and increase HDL cholesterol. So Lactobacillus acidophilus alone, or in combination with Lactobacillus lactis or Lactobacillus plantarum, have been shown to have benefit. And not surprisingly, people with elevated levels of cholesterol show the greatest benefit. And that's with any cholesterol lowering trial, whether it's diet or anything else, or drug trials, for instance. It's much easier to show an effect with elevated levels of cholesterol versus trying to bring down individuals with normal levels. So probiotics may decrease the incidence and duration of upper respiratory infections, such as colds and flus, and also decrease the use of antibiotics. So this would be the follow-up from the upper respiratory infection, the antibiotic use in children. And Lactobacillus and Bifidobacterium species have shown positive effects. So, and I wonder if this is on your mind, what about the prevention and treatment of COVID-19? So there is studies being carried out, probiotic studies, but we need to remember that most probiotics are considered dietary supplements and not drugs. So supplements and diet really shouldn't be expected to mitigate serious disease, but perhaps there may be a role in symptom management. So about the most exciting field of probiotic research is mental health. Certain probiotics, like for instance, Lactobacillus species, have small effects on depression and anxiety compared to placebo when they're tested, which means these bugs are indirectly communicating with the brain. A greater effect is seen in psychiatric cases, but again, it's difficult to study this as a treatment for disease. if I was to study the effect of probiotics on mental health, like depression or anxiety, I would likely need to study a large group of the general population with the expectation that some have depression and anxiety, and definitely with all we've been through for the last few months, there's probably a lot of people in the general public that have undiagnosed depression and anxiety. And so we could do that versus studying diagnosed patients, because again, if we were actually wanting to do a study looking at people with diagnosed condition of severe depression, for instance, we would be doing a drug trial. So we're going to stop now for some questions.
Okay, thank you, Dr. Dahl. We've had a lot of questions come in, so we'll see what we can get to. From Kay, I read research that stated the only way for probiotics to work, they need to be taken with a prebiotic. Is this correct? And what does a prebiotic do differently? And I know you're going to cover briefly prebiotics later.
And definitely no, the probiotic does not need the prebiotic at the same time, because the probiotic actually, like when, say you take a dose of 1 billion live cells. So they don't need to live and grow and replicate to have their effect. That 1 billion dose is going to get to your small intestine and beyond and have its effect. And they don't need to grow. The number doesn't need to grow to have the effect, because that's really what a prebiotic does. A prebiotic is the food for the bacteria. So yeah, definitely not. You don't need both.
And Emily is curious how probiotics produce vitamins. I've never heard of this before. Can you explain?
Well, they synthesize all sorts of things because if you think about it, they're living cells, right? They're living organisms. And so they synthesize their own proteins. They synthesize vitamins because they may need those. And some of that then gets out in the slurry in our intestine and actually can be absorbed. One of the best examples is vitamin K. Like infants, they need that vitamin K shot because they don't have an established microbiotic that can actually produce enough vitamin K to prevent vitamin K deficiency. And it's not until the kid gets a little older that the bugs, the microbes, are actually giving us a bunch of vitamin K.
Cindy asks, is there an over-the-counter probiotic supplement something that you feel is beneficial to everyone, healthy people, or is it better to eat adequate fiber-containing foods with high nutrition quality?
Wow, that is the $1 million question. And can I wait to answer that till I start to talk about that later in the presentation?
Yes, you can.
Okay.
Kay asks, is there research for the use of probiotics for someone who has had a gastric bypass?
That is an interesting question, and I don't know the answer to that question, but I definitely will follow up on that. If you save that one and send it to me,
Okay.
I will look that up, because there's definitely what we call dysbiosis with people who have had bypass. So their gut microbiota composition does change. And they tend to have, GI symptoms, but I don't know specifically if there's been probiotic trials looking at that.
Okay. I have a son and sister that has Crohn's. This is from Wendelin, and my son takes the probiotic for that.
Okay. And so the question is I'm not.
I guess if that's okay, or do you have any comment on that?
Well, with Crohn's versus other GI disease, I mean, Crohn's is such a it's such a serious inflammatory bowel disease that affects all the layers of the gut, and it's been hard to demonstrate lots of efficacy with probiotics, but there's definitely never been harm shown. So.
Okay. And then this will be the last question for this break. Emily, I'm curious about this biome, what I considered the big guns for probiotics versus Align, et cetera, for use. Thoughts, are bigger guns better?
Can you repeat the question? I'm not.
Yeah, I am curious about this biome, what I consider big guns for probiotic versus Align For use status post, I'm not sure what ABX use. Any thoughts? Are there bigger guns better?
Well, that seems like a, could I follow up on that one too?
Yes.
My response would be quite long for that one.
Okay.
Let's, to be determined.
Okay, we'll move right along. And some of these questions might get answered further along.
Okay, all right. Okay, so what is the hot research in probiotics? So they're looking into whether probiotics are effective in the prevention of gestational diabetes, periodontal disease, urinary tract infections, and all sorts of research into things to do with immunity and inflammation. And I've given you an example about COVID-19, but many other immunity, like particularly allergy. There's a lot of evidence or a lot of research looking into probiotics and allergy prevention. But I would think what I find is the most exciting of the hot research that's coming up is everything between this gut-brain axis. So that's again the probiotics communicating with the gut, and then the gut communicating with the brain and impacting things like depression and anxiety. But what the gut and the microbes can also do, they can communicate with the liver in much the same sort of mechanism where the probiotic is communicating with the cells of the gut and compounds are produced, etc., and it can actually communicate with the liver. So I predict that we're going to be looking at the effect of probiotics on conditions or diseases such as non-alcoholic fatty liver disease, which is becoming very common and is very worrisome. So it's exciting stuff. So as a reminder and something to share with your clients, probiotics should be described by genus, species, and strain, as I've given you in this image here. The label should clearly indicate the viable cells or CFUs. And you can see in the top image there, they clearly state the genus, species, and strain, and you can see that they all have those strain numbers. So they're usually letters or numbers that are the strains. And so you can see that in that probiotic supplement, there's 25 billion viable cells, and then the one below is 5 billion. And you can see with Saccharomyces boulardii, they don't put a strain often with Saccharomyces boulardii, but the studies that look at that yeast, that they all tend to work. So it's fine to choose one that does not have any more information on it. So where can health professionals and educators find information on probiotics? So there are US and Canadian probiotic guides that can be used to recommend brands of probiotics, because you probably have noticed I haven't mentioned any brands. I've only been talking about genus and species and strains at this point in time and I'm not going to recommend specific brands, but I'm going to give you, which I already have, the links to where you can find information on specific brands. So I'm most familiar with the Canadian chart because it's based on a fairly high level of evidence for the probiotics listed, and probiotics are handled differently by the Canadian government versus the US government. They're regulated. And so in order for something to be called a probiotic in Canada, they have to have a portfolio of human studies to support those effects. So let's take a look at a page of the clinical guide to probiotic products available in Canada. And again, you could go to the US one. The information and which ones that are recommended should be similar. The big difference is that there's a lot more probiotics that are available in the US than Canada, because Canada has that much higher bar for approval. And so you can see here that it lists the brand names, and then it specifically lists the probiotic strains. And so this way, what you can do is you can look at what the evidence says for a specific strain, and then you can actually go and purchase that brand. And here they also summarize the application. So these are the conditions that have been shown to be effective. And they rate that evidence based on the level of evidence. So level 1 is evidence obtained from at least one appropriately designed trial. So this would be a study that has randomization, blinding, appropriate population comparisons, all sorts of things. That's the highest level. And as I mentioned earlier in the presentation, I think it definitely should be more than one trial. It should be multiple trials. Then level 2 evidence is lower level of evidence. It's obtained from well-designed controlled trials without randomization, or evidence from randomized trials that have not had, sufficient, for instance, blinding, that type of thing. And some evidence perhaps from cohort and case control studies. And then level 3 evidence, and do I see any there? I don't see any on this list. Level 3 evidence is opinions of respective authorities and based on clinical experience, which is much, much lower level of evidence. So that gives you a guide. It talks about the dosage form, the colony forming units, and the number of doses per day. So it gives you the information that you need for the management of lots of different conditions. So let's take a look at some common questions on probiotics. So do probiotics need to be refrigerated? Well, it depends. You need to check the label, because many probiotics are shelf stable, but other ones definitely need to be refrigerated. One of the things that you still want to be careful, even for the shelf stable probiotics, you don't want them exposed to, you don't want them sitting out in sunlight. You don't want to leaving them in your hot car, because that will kill them. Next question. Do the probiotics get killed by the antibiotic that I'm taking and then not work? And I've kind of alluded to this question already today, but I'll make it a little bit more clear. Antibiotics work by preventing bacteria from replicating. And as I mentioned before, probiotics don't need to replicate to work. They just need to survive to get to their site of action, which is usually, again, the small intestine and to a certain extent, the large intestine. So you can take your probiotics and your antibiotic at the same time. And for the prevention of antibiotic-associated diarrhea, that's exactly what we'd like you to do, plus take the probiotic after you've stopped taking the antibiotics for a few weeks after that. So how often do I need to take probiotics? Should I take them daily? So daily is usually recommended. Sometimes there's multiple doses a day, but there has been almost no research looking at really how often we should take probiotics. It's something that my lab's looking into, so we really, really don't know. But it seems though, in some recent work that I actually just heard about in the last few days, research that's sampling probiotics with smart capsules in the small intestine, that it's showing in some people that it might be a better idea to take, say, 3 smaller doses in a day than 1 large dose. And so stay tuned. We're going to hear more about that. So what happens when I stop taking a probiotic? So the probiotic, it will be washed out. And when we say washed out, it means that it becomes non-detectable in stool. So if we were going to test to see if it was there, it's gone. So probiotics aren't meant to take up residence and permanently colonize in the gut. This could take a day or a month, depending on the person and the probiotic. And then, so this is something else that my lab at the University of Florida is looking into. So when during the day should I take a probiotic? We don't know the answer to that either. Probiotics are likely best taken with a meal though. That protects them from stomach acid. So probiotics promote wellness and help to treat and prevent disease in some cases. But one of the things to keep in mind is that no bifidobacterium and lactobacillus species are pathogens, so they are safe. So no matter what the strain is, they are considered safe. But species and strain and dose are really important for the desired health effects. So one of the last question about probiotics that I want to discuss today is whether or not probiotics alter our gut microbiota. And I think that's what we hear out in the media, that you got to take a probiotic because that's going to help with your microbiota composition. And so when I'm talking about the microbiota, I'm talking about the microorganisms that colonize our gut. So whether or not a probiotic affects our microbiota composition depends on whether we are healthy and have a balanced microbiota. If we do, probiotics tend to come and go without disturbing the balance. For those who have a disrupted microbiota, which we call dysbiosis, probiotics can help to reestablish the balance. And this actually makes sense if you think about how many microbes we have in the GI tract. So let's look at the figure. Let's look at the stomach first. So the stomach has very low levels of microbes in general. And that's at least for people that aren't taking any antacids or any medications to reduce stomach acid. If people are taking medicines to reduce stomach acids, the level of microbes are much, much higher in the stomach. So it is that acid that keeps them low. So as we go through the small intestine, the species and the genus and species change, and the numbers start to increase. But if you look, like even in like the ileum, if you take 1 billion probiotic or a dose of 1 billion probiotics, the probiotics really, that dose is going to have a fighting chance in the small intestine. And so if you were to sample your small intestine and see after you've taken a probiotic, most of those microbes that you're actually going to find are the probiotic microbes. So it's thought that probiotics are likely exerting most of their effects through the interactions, like, so that communication I was talking to you about, that communication with the gut and the brain and the liver and all of that, those interactions are likely mostly in the small intestine, where the microbe counts, the probiotic are higher in comparison to the other microbes that are there, and they have that advantage. And if you see, by the time they get to the colon has trillions of bacteria, and so the probiotics are outnumbered, although one would argue that they may still be having effects in the colon. So there's been some questions about prebiotics, and so I'm going to talk a little bit about prebiotics. Sometimes probiotic products contain prebiotics, but a prebiotic is a substrate. It's defined as a substrate that is selectively utilized by host microorganisms, conferring a health benefit. And so by definition, prebiotics are supposed to enhance the microorganisms that are already in our gut. So most prebiotics are digestible oligosaccharides, or sorry, non-digestible oligosaccharides. So they transit the small intestine unchanged and then are fermented in the colon. So so common prebiotics, I suppose the original prebiotic is in human milk, the oligosaccharides. There's all sorts of different structures of oligosaccharides that are in human milk, and that's why infants have high levels of bifidobacterium if they're breastfed. But fructans in onions and chicory root and prebiotic fibers are often added to processed foods. So it's hard to not find an item in the grocery store that doesn't have like added chicory root fiber, which is inulin, or fructooligosaccharides, for instance. And so those are the tested prebiotics. But when you read things about prebiotics, it seems like they're calling most everything prebiotics. So we're going to talk a little bit more about that. Prebiotics increase bifidobacterium species. So this is the selective utilization. So in that definition of prebiotic, it's a substrate that is selectively utilized by host microorganisms. And so that's usually the bifidobacterium. So, but the prebiotic may also increase potentially other health enhancing bacteria, which are residents of our GI tract, but they may also be utilized by other microbes and cause gas and bloating because some Clostridia species in our gut use fructans, for instance, and they can produce a lot of gas and discomfort. So what is my area? Like, yes, I do probiotic research, but my main area is dietary fiber. And what is important to remember is that we feed our gut microbiota much more than these select prebiotics. We feed about 17 grams of fiber a day. So that's the average intake in the US. Of course, our recommendations are much higher. I'd like to see everybody over 25 plus grams of fiber a day, maybe even 30, 35, 40 grams of fiber a day. Some starch that is resistant to digestion also gets to the colon and is fermented. Also some protein. Surprisingly, about the same with our lower fiber diets, about the same amount of protein is malabsorbed and gets to the colon and provides substrate for the bacteria, but little fat. There's a lot of other compounds such as polyphenols, bile acids that reach the colon and are metabolized by the microbiota. So in a nutshell, fiber, some of which is prebiotic, and unabsorbed starch and sugars and are fermented to produce short chain fatty acids, mainly acetate, butyrate, and propionate. And butyrate is especially important for the health of the GI tract. So it's super important for inflammatory bowel disease and just general health. But also the fiber, the non-digestible carbohydrates support the growth and modify the composition of the microbiota. And unfortunately, also gas production as a byproduct. But as I mentioned, some protein and amino acids also escape digestion, especially when we're consuming a high protein diet. And these are metabolized more so to amines, phenols, and other compounds that have negative health effects. So microbiome and probiotic research is now exploring how we actually can reduce some of these inflammatory compounds, these amines and phenols. So these are metabolites of amino acids, particularly phenylalanine, tyrosine, and tryptophan. My research group is interested in this line of research because it's these amines and phenols, these inflammatory compounds that increase dramatically in chronic kidney disease. And we know that about 13% of the US population has chronic kidney disease. So, and these compounds contribute to further kidney damage and uremic symptoms. So there's going to be a big area of research expanding, looking at how probiotics and dietary manipulation can reduce these inflammatory compounds. So our gut microbiota and what it produces, what we call its metabolic activity, is very much affected by our diet composition. High fiber versus high protein, for example, and at least in healthy people, it affects our microbiota composition and the metabolites it produces, really much more so than if we take a probiotic. So an important take-home message is that many foods and fibers are referred to as prebiotic, but actually they're not selective and thus really don't fit in the definition of prebiotic. But I would argue that a diet with many foods and fibers is probably more important to consume that type of diet than it is to take a prebiotic, because it's more beneficial because these fibers produce diverse and stable microbiota versus just perhaps enhancing bifido. I mean, bifido are healthy, but there's so much more to the microbiota than just bifidobacteria. So in conclusion, and as a registered dietitian, I can't help but really conclude that really consuming a diet with plenty of whole and minimally processed plant source foods, so that of course includes vegetables, fruits, grains, legumes, nuts, and seeds, provides the optimum food for a gut microbiota, and that supports health. So I worry about low carbohydrate, high fat, high protein diets without adequate fiber, and especially diets that are high in ultra processed foods, because they may not support an optimal microbiota. So, and will probiotics be able to restore that? Well, they have their health effects, but can they actually make up for a poor diet? And I would argue, no, not completely. So probiotics help to restore the balance of the microbiota disrupted by diet. So they help, but they don't necessarily solve all the problems. Disease, antibiotic stress, and may have specific health effects. and some resources. So the first link there is a summary. It really summarizes some of the health conditions that I talked about today. It's just a brief review, and it also contains all of the references, or most all of the references that I've used for today. And below that are a couple of client resources, and I think the organizers have shared a few more resources. So I welcome your questions.
Thank you so much, Dr. Dahl. We have lots of questions coming in, and I'm not sure we're going to get to all of them. I was wondering, if we don't get to all of them, could you answer them in writing if I provide them to you, and I'll post it as a blog post?
I could, as long as there's not over 100.
There's not over 100, yes. Okay, so how well does the average primary care doctor understand probiotic therapy and prescribe it appropriately? Or is it only GI specialists and psychiatrists?
You know, I can't answer that question, but my guess is, like, I do work, I do some collaborative research with physicians, and they're asking us the questions. So I would double check everything. So even if it was a specialist that recommended a certain type of probiotic, I would actually go to, like, for instance, that guide that I showed you, I would go there and see, because I think some of them just have their favorite probiotic, and they just recommend that, thinking that, you know, a probiotic is a probiotic. Because they sure wouldn't do that with recommending drugs, for instance. They wouldn't say, oh, I'll just take any drug and that'll help, you know, and that's not the way it works with probiotics, even though that many probiotics have, again, the general beneficial effects on GI health. Some of these other health effects that we're after are specific perhaps to strains. So you want to make sure that you're taking that exact strain, and you want to make sure that you're taking it at the level that is supported by research. And so, yeah, I would double check on everything they say, because they got a lot of things on their plate. And I don't think spending, you know, every evening reading probiotic research is what they do.
And Raylene would like to know, do probiotics interact or interfere with any commonly prescribed medications or supplements? What's told by one doctor might interfere with Synthroid.
I don't know specifically with Synthroid. I'd have to look that up, but I'm not aware of any probiotic medication interactions.
And then one last question, thoughts on the future of probiotics specifically related to food allergies?
Oh, I think that's a whole nother presentation. It really is. It's very complex because, of course, there's all sorts of different allergies, and really it's about the prevention of allergies, and the whole field of allergy prevention has been turned on its head. Because remember, we used to, like, for instance, with infants, we used to not expose them to potential allergens when they were, you know, less than a year, in the hopes of preventing allergens. And we've done a major disservice to a generation of children by causing more allergies doing that. So the whole really field of allergy prevention is turned on its head, and probiotics are part of that. But since there's so many different types, but one of the things that probiotics definitely mechanism wise is important. Remember what I mentioned about the leaky gut and those tight junctions, because if the junctions aren't tight, of course, then whole proteins can get in and then elicit an immune response, which becomes an allergy. And so if the probiotic is involved with making sure that those tight junctions are tight, and preventing the movement of whole proteins into the system, that's one of the mechanisms.
Well, thank you. This has been wonderful, Dr. Dahl, and wonderful presentation and so much valuable information. And thank you to all of our participants for all your questions and for participating. Lots of food for thought. We will collect these questions, and I will send them to you, Dr. Dahl, and get them out, posted on a blog, so everyone can get their questions answered.
Thank you very much, Raman.
Nutrition and wellness is very happy to bring you this upcoming webinar, Navy Operational Fitness and Fueling Systems, the Foundation for Physical Readiness, June 22nd at 11 a.m. You can use the event page listed on this slide to RSVP. We are also offering 1 CPEU for registered dietitians and dietetic technicians for today's webinar. To receive your CDR CPEU certificate, please visit the webinar event page listed on this slide. You will find the purple evaluation link on the event page. After completing the evaluation, you'll be directed to fill in your name and email. Your CPEU certificate will be emailed to you. Government addresses such as .gov and .mil frequently will not accept automated email, so you may want to use a personal email address. Any questions about your certificate, please contact Kristen DeFilippo, and her email is also listed on this slide. A recording of today's webinar will be archived within 48 hours to our YouTube channel. All of our past nutrition and wellness webinars can be viewed as CPEU credits earned up to 1 year post-webinar. And we invite you to stay connected with MFLN Nutrition and Wellness team. You can subscribe to our listserv on our website to receive quarterly newsletters, and follow us on Twitter at MFLNNW for webinar reminders and information. I will now turn it back over to Coral.
Thanks so much, Robin. I want to echo Robin's thanks to Dr. Dahl for her incredible expertise and for such an engaging presentation today. There's so much here, and obviously so much more that can be discussed on this topic. So riveting, much appreciated. Also, thank you everyone for your questions. As Robin mentioned, there will be a follow-up blog for the couple of outstanding questions that remain. So be sure to check back on the event page for that. And also know that you can share the recording of this webinar with any of your colleagues or affiliates who may be interested. It is free and open access, and that will be posted to the event page as well in the next couple of business days. So thanks again for joining us. We'll hang out here for just a couple of more minutes in case you need to grab any links, but please be reminded that all of the resources, today's slides, and additional information are available on that event page. So thanks again for joining us. We hope you have a great rest of your week, and we'll see you again soon. Just saw a comment. The continuing education link is available right below the continuing education header. Okay, there seems that there's a bit of a technical hiccup, so please just check back in the next little bit. We'll be sure to get that all sorted out. So thanks again, everybody, for your patience on that. We're going to go ahead and hop off for today. Again, thanks again for tuning in, and we'll get that link straightened out here in just the next couple of minutes. Take care. Have a great day.